name is Olivia Kroll. I'm going to be your nurse today. Today we're just going to be doing a neck, vein, heart, and peripheral vascular assessment on you. We'll help you through it as we go along. Just give you a few commands. It should not be that hard and it shouldn't take that long either. So I'll begin by washing my hands. And can you please state your full name for me?
Zulena Kroll.
And your date of birth?
March 8, 1967.
All right. And is there anything in your past or present medical history I should know about before I start the assessment?
No.
No? All right. Do you have any heart dysrhythmias? And do you and your family have a history of congenital heart failure?
No.
No? Okay. Well, first we're going to start by assessing jugular vein distension. And the patient's at a 45-degree angle. I'm on her right side. I'm going to remove the pillow. Can you please look to your left for me? All right. I do not see any jugular vein distension. If there were, I'd have to notify a physician immediately because it could be a sign of coronary heart failure or congestive heart failure. You can lift your head up. I'll put the pillow back. Thank you so much. Next, I'm going to be looking at your carotid pulse. So I'm just going to do your right side. And it's a strong +2 regular rate and rhythm on the right side. Now I'll take your left side. And it's a strong +2 regular rate and rhythm. And now I'm going to auscultate your carotid using the bell of my stethoscope, and I'm just going to be listening for any bruits. So if you could look to the left and then hold your breath for me, please. All right, thank you. No bruit noted. And if you could look to your right and then hold your breath for me. All right, thank you. And then there are no bruits noted on the right or the left. So now, if you could just lay down for me, and we're going to be beginning our heart assessment. So I'm just going to check, and I'm just checking for any lifts, heaves, or pulsations. We would see lifts in the sternal area anteriorly. We would see heaves right below your rib cage near the midline. I'm not seeing any heaves and pulsations. I don't see, which would be in the intercostal spaces and near the sternum. I'm not seeing anything but normal respiration. All right, so now I'm gonna listen and auscultate to the 5 heart sounds. So we're going to begin at the aortic, which is at the base of the heart, and it's in the second intercostal space to the right of the sternum. You can hear S2 in this space. Next, we're going to do the pulmonic, which is in the second intercostal space. It's left of the sternal border. Here you can also hear S2. Now we're going to be going to Erb's point, which is left of the sternal border in the third intercostal space. So right about here. Hear heart murmurs. You can usually hear, but I'm not noting any heart murmurs today. So now we're going to go to the tricuspid, which is in the fourth intercostal space, left of the sternal border. Here you can hear S1 the loudest. And lastly, we're going to be looking at the mitral, which is in the 5th intercostal space left of the midclavicular line. Sorry. And here you can also hear S1 the loudest. Okay, thank you. So we'll just cover you back up. Thank you so much. And we're going to begin the peripheral vascular assessment. All right, you can just stay right where you are. Normally we would assess both legs, but in this video we are only assessing one. So I'm just going to be checking the leg for any color variations. I see that the leg is a nice, even, light beige color. There's no variations in color. I'm not noting any venous pattern, and I'm also not noting any lesions in this leg. Next, I'll be looking for primary, secondary, and vascular lesions. In this case, I am seeing one primary lesion in the form of a freckle. It's lateral to the top of the tibial bone. It's less than 1 millimeter in diameter. It's a light brown color all the way throughout, and it's non-raised. I'm also seeing another primary lesion in the form of the freckle, and it's right on the tibial bone, inferior to the kneecap, and it's less than 1 millimeter in diameter. It's evenly brown, it's non-raised and flat. When you're assessing lesions, it's good to go through the ABCD method, where A would be, is it asymmetrical? B, are there irregular borders? C is if there's color variations within the lesion. D is if the diameter is bigger than 6 millimeters. And E if it's elevated or evolved or enlarged. That could mean the lesion is at risk for melanoma. So now we're gonna go ahead and check the pulses. We're gonna note that there is the femoral pulse on the inner thigh. And we're gonna move to the popliteal pulse, which is posterior to the kneecap and lateral to the medial tendon. I'm actually, I can feel the popliteal pulse. It is strong, and it has a regular rate and rhythm. I would give it a +2. You also check the pulse in the posterior tibial pulse, which is strong with a regular rate and rhythm. I would also give it a +2. And you can check the dorsalis pedis pulse, which is a strong regular rate and rhythm, and I would also give that a +2. And now I'm gonna palpate and I'm gonna check the leg for moisture and temperature. All right, so no moisture. It's a nice warm leg, and it gets colder as you go peripherally to the toes. And now I'm going to palpate for edema using both of my thumbs. And just going down the tibial, or the tibia. any edema. So now we're gonna go ahead and we're gonna look at the toes. I note that the toes are a nice light pink pearly color. They're intact and I do not see any signs of lesions. I'm gonna go ahead and check the capillary refill. And the capillaries refill very promptly within like 1 to 2 seconds. And I'm going to go ahead and look for ulcerations, making sure I check in between the toes and the heel of the foot. And I'm not noting any ulcerations. So thank you so much. That concludes today's assessment. The doctor will be in with you shortly. I'm going to leave the call light right here. If you need anything, don't hesitate to ask. I'm going to put up your bed rails for safety. And I'll wash my hands. The doctor will be in with you shortly. It's been a pleasure. Thank you.